All right, welcome back, friends. It is Friday, and I think what we're going to start doing is start talking to Councilman Hardin on Fridays because he has a lot of good information and can share with us what's going on in Columbus. So, welcome back.
Thank you
So,
so much for having me. Happy Friday.
happy Friday. We're about 2 weeks into our stay-at-home mandate, and I think we're seeing people complying pretty well. I think we're probably seeing this is about the time we're going to start seeing results from us staying at home.
Yeah.
And you had some new numbers.
Yeah. So we are able to, I get a briefing from public health every other day with new numbers and where we stand in Columbus and Franklin County. And that call happened about 20 minutes ago. And so this is the newest information that we have out of Columbus. Right now, there are 351 cases. That was an increase of 99 since Wednesday when I was briefed in Columbus. There were 510 cases in Franklin County. That's an increase of 102 since I was last briefed on Wednesday. What stood out to me and what I had to ask the question literally 3 times, partly because my dogs were barking in the background, but also because I was literally shocked by what I was hearing, was that the majority of cases in the city of Columbus are ages 20 through 29.
Okay, so you don't have a percentage. We don't have a percentage
We
this
don't
week,
have a
but
percentage yet, but and we'll work to get one out. But more than 50%, the
okay.
majority, they were very, very clear on that, are ages 20 to 29. They also said that the profession that has the most cases are healthcare workers,
Right.
and the age group that has the most cases are 20 through 29.
Okay. Well, hopefully we that we're getting that message out there for everybody to keep those to stay at home. And one of the other things that we were talking about a little bit and is a big debate right now is, do we need to be wearing masks? And it's not a surprise. I think when we see all these people getting sick asymptomatic or spreading it asymptomatically, they're not necessarily coughing and sneezing. And that 6-foot area we talk about is just kind of where we think that the respiratory droplets go when you cough or sneeze. It's not a halo. It doesn't follow people around. So,
Right.
Even if, when I'm happy that people are outside, I'm glad people are outside exercising, but you have to keep that in mind if you're walking towards somebody or walking behind them. Even, I mean, granted, if there's a breeze, it's going to disperse those droplets, but we still got to keep that in mind. Or even if we're in the grocery store, when people are exercising, they're going to be breathing heavy. There's a chance they're aerosolizing this virus.
Yes.
And in the grocery store, just because you're 6 feet behind somebody, I mean, if they cough or if they, possibly if they are in a phase of their of being infected where they have a high viral load, I mean, I suppose it's possible if they take a deep breath and you're walking behind them, it's going to be out there. So we just need to
Yes.
keep that in mind. The question about masks.
Yeah, we don't have got again. We had this conversation on the health call just a few minutes ago. Guidance is not out there yet. I know that this is a conversation that is being considered locally, statewide, and federally. I think that one of the things that we are all concerned about and will have to balance, regardless of what the recommendation or what the advice is that the critical mask, the N95 mask, should have to be reserved for healthcare workers.
Right.
We are still going to hit our surge, and they are going to need those personal protective equipment. And so, regardless of what the guidelines come down to, we all are trying to balance to make sure that we are advising what types of face
Right.
masks one would use and when they would use it, just so that we are reserving the right mask for our most at risk.
Yeah, and I think the guidance will come up. I think it will kind of come out saying, yeah, if you're outside, if you're around other people, especially in some place like the store,
Yeah.
I think we're going to end up going more towards yes, wear a mask. And I think at that point, although we haven't tested them, I think the cloth masks people are making are going to be fine because they're going
So
to.
this is a mask that my husband bought me
Mhm.
a long time ago. It is a cloth mask.
Yeah.
And
And now you look like a ninja.
and I look like a ninja. So, but I have not worn it recently because I didn't want to get ahead of
Hmm.
um, the recommendations. But that's the type of mask that I would wear if if we go to that direction. Is
Right.
one that is definitely not. This would not protect a healthcare worker, but may give me just a little bit more.
Right. And really, what we're trying to do is decrease the spreading of the of droplets of particles when people are breathing out too. So that's really what we're trying to do. Um, the other thing we were talking about, so I think we are going to go in that direction probably. If I were to guess, I think we are seeing good results. They last week they made the announcement that if we have a surge site, all the hospitals in Central Ohio are working together, Ohio State, Ohio Health, and Mount Carmel. And
Yes.
if those hospitals reach capacity, the overflow site would be the Greater Columbus Convention Center. They expect
Yes.
they could hold about 1,000 people there.
Yes.
Correct? Are they already working on building that out?
Yeah. So what I was briefed on earlier this week was the capacity that those three hospital systems are setting up. They will all have a certain amount of beds that they will run inside the convention center. The one thing that where we are already ahead of, say, New York City, is that these hospital systems have a kind of a long history of kind of working together, and that is not normal everywhere. One of the examples is we have a new stroke unit that works between the hospital systems that regardless of who calls in, they gets them to the closest the closest hospital system, and they share the information and even share doctors who work the stroke unit.
Okay.
So we have a bit of a advantage in terms of the silos that some of these communities are going to face as the surge happens, and making sure that we're all one hospital unit in Columbus, and sharing information, and sharing bed numbers on beds and data on who, so that we are adequately serving folks. So that's something that I am. I've been saying that every day that we're not in the surge is our process preparedness day, making sure that our processes are as tight as possible. So and we still do expect a surge,
Right.
but we do believe that we're having positive effects on the curve, in
Right.
flattening the curve, but we still believe that we
And
will have a surge. But we think that each day that we're working on the process, we're more prepared.
yeah, and the other thing to keep in mind is as we are able to kind of prolong the time until we hit that surge, things are happening and they're happening quickly. For example, the N95 masks that we're so concerned about, we're not going to have enough of. On Monday, the FDA did approve. Uh, Battelle, which is based here in Columbus, has made those decontamination units, and they approved them to work full speed, full
Yes.
capacity, so they can sterilize 80,000 masks per unit per day. So
Yeah.
we've got two of them in Ohio, and I think they've sent two to New York. I think one's going to Seattle, one's going to DC. Uh, that's something that we're going to have the advantage of, because in New York they're already getting slammed. They've already hit their surge, or they're
Right.
in the midst of it.
Right.
That's going to give us a chance to protect the healthcare workers, which are the people that, as you said, are skewed towards being more infected right now. The other thing that happened is Battelle, also amazing, but they just do amazing stuff, is working with Ohio State on a test that they think they're going to be able to do
Yeah.
200 a day to start. It should be up to, once they get everything running, it should be up to about 1,000 tests per day run out of Ohio State and Battelle. So every day that we are seeing results from staying at home, from practicing these guidelines. So
Let's keep at them. I mean, we're going
yeah.
into the weekend, and the weather's going to be beautiful. Remember the things that we can do, like outdoor exercise, as long as we're social distancing. I'm going to go fishing. It's my birthday weekend. I love to
Oh, happy
fish,
birthday.
and so I'm going to go out fishing one of these days this weekend. But it will get it gets harder for me again, like for all of us, when we're really asking folks to do this social distancing. We're talking about staying away from some friends and some family members, and it wears on you, but it is working. And we're really talking about saving lives here, and we can see the effect. I mean, Ohio is looking better than other states who did not act as quickly as others, as we did, and we have to keep that up. And I'm actually proud of our leadership, but I'm also more proud of our people for hanging in there with us and taking this seriously. And we just really need to lean into that as we go into the weekend. Um, uh, that we all play a role in this. Like we're all actually soldiers in this fight,
Yes.
in this war. So
Yeah, it takes all of us, and like we've always said the whole time, we're all in this together.
yeah,
It's going to be hard, and I know it's scary, especially with uh, financial consequences and
yeah.
having if you're out of work and then you have to pay your rent or your mortgage. A lot of we're all working together. We're all being affected by this. The government knows it. The banks know it. So I think we're going to be in good hands. Anything else, Shannon?
That's pretty much it for me. I think again, the governor extended the stay-at-home order to May 1st. That is another month. Let's keep at it, and let's keep doing all of our part to flatten the curve.
Yeah, and again, the highest rate, the majority of cases in uh, Columbus, or is it Franklin County, or just the
In
Franklin
Columbus,
and Columbus and Worthington, since that's the
yes, and
jurisdiction of the
Worthington,
Columbus
yes.
Public Health Department, uh, are 20 to 29. So we really gotta, that's where we gotta kind of try to remind our friends that are younger to practice social distancing.
And
All
again,
right.
just a shout out to all the first responders and folks, the healthcare workers who are literally putting their lives on the line to keep us all safe. Like, let's
Yeah, and
do it for them.
a quick way for you guys to know if we're doing a good job is if I have to wear an N95 mask, the beard goes. So if you see me baby faced again, that means that
You've been called in.
I've been called in. So otherwise, we're just going to keep doing our business here as usual. Thanks again for your time. I guess we'll do this again next Friday, and you can tell us all about your fishing trip, and have a wonderful
Yes.
birthday.
Thank you
Councilman
so
Hardin, thanks for your
much.
time. All right, guys. Hope you guys have a good weekend. Keep it up. I think we're seeing the effects of everything we're doing all together. So be safe out there, and I guess we'll see you next week.